Worms are some of the neglected parasites causing everlasting pain in the lives of many people. These stubborn parasites thrive in contaminated water. Dr. Moses Muwanguzi, the medical superintendent at Entebbe Hospital, confirms the facility with a catchment area of 1.5 million people is facing an ever-growing number of people ailing with neglected tropical diseases.
We see a wide range of diseases, basically tropical diseases, and the respiratory tract infections. There are people who come from the nearby areas like the islands which don't have services. These people always come in a critical situation.
These patients sharing food with parasites in their bodies come from different parts of WAKISO district, most especially the islanders. This has caused pressure on the facility, especially supplies, as the number of patients does not match the type of care meant to be offered here.
Then outreach services, where we go out into the community to see those people who haven't come to the hospital. Averagely in a day, outpatient, we see over 300 patients, and inpatients we have over 90% coverage.
The big numbers have now pushed the hospital administrators to constantly organize outreach services so they can help those that are not able to come to the hospital. The stubbornness of the tropical yet neglected diseases includes snail fever, elephantiasis, river blindness, and hookworm. Other people have been victims to trachoma, which has caused blindness due to delay to access health care. For example, snail fever comes from snails that live in contaminated water. The water that gives life can equally bring death, while elephantiasis is spread by little worms coming from mosquito bites. Hookworms feed on the victim's intestines, and if not timely attended to, they cause diarrhea and eventually death. The World Health Organization confirms many countries have neglected these diseases, yet they are killing millions of people every year, world over. World Health Organization now recommends all countries should provide safe water, massive sensitization of locals in affected countries about the need to boil all water, observe sanitation and proper hygiene. I am Fatuma Nalwanga for Urban TV.